Hello, this is Dr. Gay from First Look MRI, and this is a 57-year-old male injured their shoulder a couple weeks ago. They have continued pain, and we can see something wrong over here. This is the biceps labral anchor right here, and if we look for the biceps tendon, it comes across here. It's thick and irregular, and then it's absent through the interarticular portion here and into the bicipital groove. So I have a ruptured biceps tendon, and the proximal end is thick and irregular. And also the subscapularis tendon does not look quite right. So we're going to look on the axials and sagittals to see the subscap a little bit better. A lot of times when they have biceps tendon tears, they have also tears of the subscapularis, as in this case. So this is an axial view. We can see the subscapularis tendon here in the front. Here's the back here, nice deltoid. And the subscapularis muscle is here. The central tendon is here. And when we get over here, we see that there is a change in thickness. Here's a little bit thicker, and here's a little bit thinner. So they have an undersurface tear of the subscapularis. It goes from about here all the way to the lesser tuberosity. And also over here we see the bicipital groove is filled with this fluid, and we really don't see a nice normal biceps tendon. So it looks like the biceps tendon is ruptured and retracted below the groove, and this is some scarring or fibrosis in the bicipital groove. Now there's another thing here. We're going to look at this in just a minute. The middle glenohumeral ligament and superior glenohumeral ligament are both in this area, and those are the things to comment on. So first we're going to start with the sagittal and look at that subscap better. Now here's the front on the sagittal. This is the subscapularis, and you can see that there's a carved out area here. This is the subscapularis tendon right in the middle, so a definite partial thickness undersurface tear. You can see the thickness is increased down at the bottom, and you see that fluid here. So they have a partial thickness tear. Right here it looks like it goes maybe 75% of the AP tendon thickness, and the remaining rotator cuff looks pretty good. So a broad tear with partial thickness undersurface tearing of the subscapularis tendon. And now we're going to look for the middle glenohumeral ligament and the superior glenohumeral ligament. So the MGHL and superior glenohumeral ligament both come off about right here. The superior glenohumeral ligament comes over the top, and it usually just blends nicely with the top of the subscapularis. It's hard to see most of the time, but if you go back and forth, you can usually imagine some little band coming over and attaching nicely. This one I can see the band coming over. It's really foggy and thick, and then it does not blend. It looks like it's elevated here. So there's a separation between this glob and the subscapularis. So this is a ruptured superior glenohumeral ligament. And the MGHL comes down like this direction, deep to the subscapularis, and it usually just blends right with the deep fibers and joint capsule here. And I do not see it at all. So it looks like the middle glenohumeral ligament is ruptured as well. And when you see the undersurface torn here, almost always the MGHL will be torn because the MGHL comes down and it blends with that. So if the undersurface fibers are all torn, that's right where it attaches. It almost has to be torn. And we'll see both these things on this axial view. So here's where they come off together. The superior glenohumeral ligament will go forward and blend over here. It's really hard to see in axial images. I can't say I can definitely see it, but maybe this little glob here is part of it. And we just don't see a nice blending with the subscap. But the middle glenohumeral ligament is what you see best on axial. So here's the axial view. We're going to follow something from here down, hopefully seeing that. But instead we see nothing on the next cut. So we're going to go back up. Next cut down, nothing. So we should see something that looks like a vertical band coming down and then attaching to the subscapularis, blending with it. But instead we see the anterior labrum, we see the subscap, and we do not see the MGHL, which should be right in between those. So that's it. A tear of the subscapularis tendon, the undersurface fibers, a ruptured biceps tendon, and tear of the middle glenohumeral ligament and the superior glenohumeral ligament.